Clinical depression can be debilitating and devastating to the individuals suffering from it. It cripples their emotions, relationships, productivity, and lifestyle. Moreover, being an invisible disorder unlike fever or jaundice where the symptoms are visible, the victim of depression is often ridiculed and gaslighted by their peer group, family, and friends. Though clinical depression is treatable with the help of medications and/or psychotherapy, in some cases, they don't work. Such patients run from pillar to post in search of some relief from their pain and helplessness, often taking multiple medications or different types of psychotherapies without much benefit. Boys and girls, today, in this video, we delve into the world of resistant depression and find out how rTMS, a safe, effective non-invasive neuromodulation treatment, is bringing smiles into the lives of such poor souls suffering from resistant clinical depression. Treatment-resistant depression refers to a condition in which standard treatments for depression, such as medication and/or psychotherapy, do not provide adequate relief of symptoms. Treatment-resistant depression patients often take multiple medications, but still there is no significant relief in their depressive symptoms. Finding effective treatments for treatment-resistant depression is crucial to improve quality of life, reduce suffering, prevent suicide, alleviate economic burdens, and advancing scientific knowledge. It helps individuals with persistent and severe symptoms, reduces the risk of suicide, and lessens the economic impact. rTMS, repetitive transcranial magnetic stimulation, is the latest cutting-edge, non-invasive medical technology that uses magnetic fields to stimulate nerve cells in the brain, offering a potential treatment for patients with treatment-resistant depression. It is a neuromodulation technique that is safe, effective, and well tolerated with very minimal side effects compared to medications or other neuromodulation techniques like electroconvulsive therapy or ECT. rTMS involves placing a specialized coil on specific locations on the scalp and applying magnetic pulses to underlying specific brain regions associated with mood regulation like the prefrontal cortex. The magnetic pulses are given in specific frequencies, which the neurons can understand. These frequencies and protocols are selected after a lot of research, and they help to modulate the way the particular circuit of neurons communicate with each other. Thus, rTMS is believed to modulate neural activity and rebalance abnormal circuits involved in depression. Treatment is administered 5 days a week, over 4 to 6 weeks, and is generally safe, with minimal to no side effects. Research, including randomized controlled trials and meta-analysis, supports the effectiveness of repetitive transcranial magnetic stimulation in treating treatment-resistant depression. Studies have consistently shown that active rTMS leads to significant improvements in depressive symptoms compared to sham stimulation. The effects of rTMS can endure for several months to more than a year after treatment completion. Real-world studies and clinical guidelines further reinforce its efficacy. However, individual responses may vary, and a small percentage may not experience substantial benefits. Consulting with a healthcare professional knowledgeable and experienced in rTMS is essential to determine suitability and discuss potential risks and benefits. Overall, rTMS offers a promising alternative for those who have not responded to other interventions in treating treatment-resistant depression. rTMS has been shown to effectively reduce depressive symptoms in individuals who have not responded to traditional treatments like medications and psychotherapy. Research studies have consistently demonstrated its efficacy, with significant improvements in depressive symptoms reported. rTMS is a non-invasive procedure that does not require anesthesia or surgery. It involves placing a magnetic coil on the scalp, and magnetic pulses are delivered to specific brain regions associated with mood regulation. The non-invasive nature of rTMS makes it a safer and more tolerable treatment option compared to invasive procedures like ECT or vagal nerve stimulation therapies. rTMS is generally well tolerated, with very minimal side effects. Common side effects include mild scalp discomfort or headache during or immediately after the treatment session. These side effects are typically transient and diminish over time. Compared to some other treatments for depression, such as medications or electroconvulsive therapy, rTMS has much fewer associated side effects. rTMS allows for targeted stimulation of specific brain regions involved in mood regulation, such as the prefrontal cortex. By focusing on these areas, rTMS aims to directly modulate the neural circuits associated with depression, offering a more precise and individualized treatment approach free from generalized side effects as common with other forms of therapies like medications or ECT. Studies have shown that the benefits of rTMS can persist much beyond the treatment period. Many individuals experience sustained improvements in depressive symptoms for a year or even more, leading to long-term relief and enhanced quality of life. rTMS can be used as an adjunctive treatment alongside other interventions, such as medications or psychotherapy. It can complement existing treatments and potentially enhance their effectiveness in individuals with treatment-resistant depression. Also, for individuals who cannot tolerate or prefer not to use certain treatments like medications or ECT, rTMS can offer a viable and effective treatment alternative. It provides a non-pharmacological option with a different mechanism of action. rTMS is a non-invasive and well-tolerated treatment option for patients with treatment-resistant depression, offering improved mood, minimal side effects, and the potential for long-lasting effects. While rTMS offers significant benefits, it is important to note that individual responses may vary, and it may not be suitable or effective for everyone. Consulting with a healthcare professional knowledgeable and experienced in rTMS is crucial to determine the appropriateness of rTMS as a treatment option for treatment-resistant depression for the index patient.